Jackie. Jackie, that's
Hi, nice to meet
Amanda.
you.
Hi, you as well. I've been looking forward to it. I've heard so much about you through
Yeah,
Angie,
Likewise.
so this is great.
yeah, it is. It's such a great thing. And so we're going to just jump right in. So Optimal State AZ, that's what you run your PEMF company through, correct,
Correct.
Amanda?
Yes, that's it.
So last month we were on and we were just talking about pain management techniques and how, of course, everybody immediately thinks with pain management, we go to medication. And
Right.
that is not sustainable. And as much as there is a time and place for it, it is just not sustainable pain management for an amputee that will never get that leg back and may have phantom pain the rest of their life. We need to find a
Right.
better avenue that's healthier long term. And so Jackie and I talked about some pain management techniques in part one last month. And that's on our feed for those of
Yes.
you that are watching now. If you want to see what we talked about the first month, this month I've been very, very excited. This is where my PT worlds collide. My PT
Mhm.
pre-amputation introduced me to Amanda. And
Yeah.
Amanda works with pulsating electromagnetic frequency. Is that right?
Field. Yes.
Field.
Yeah.
Oh, field. That's the PEMF. And if you say it fast
Yes.
enough, you usually lose the E somewhere in there.
Yeah.
But I would love for you to talk to us about it. And Jackie, and I'm still dying to hear if Touchtone even has that unit there, or if anybody's
No.
trained. Do they have it at all?
No.
They don't. Okay, so Amanda, this is a great location for us to mingle and another avenue. So Amanda, can you tell us, I want to know what got you started in doing the
Oh,
PEMF?
sorry. I had a
No, that's
phone call
okay.
come through.
Oh, that's what that was. What got you started? Tell them the story you told me, because it really helped me kind of almost buy into the fact that this was a real pain
Yeah,
management
because it
tool.
took me a minute too. At first, I had hurt my shoulder years ago trying to learn to golf. It is was not my sport, and first timer pulled out my shoulder, subluxed it, and so then from there it took maybe a couple months for me to get back to where I felt like I had full strength again, working out, trying just my own things. But that was a long time for me to feel out for 2 months. So fast forward a few years later, I did it again, hitting off mats at Top Golf. So I shouldn't be going there anymore.
Maybe don't
It's
golf.
not my thing. Um, and I was so bummed. It was right when tennis season had started. And one of my good friends, who's a nutritional therapist, was like, "You've got to try PEMF. It helped my hips so much." And I'm like, "It sounds kind of weird, a little out there. I'm not sure." She's like, "I'll go with you. We'll just do it together." So I tried it out. And I went to Jill she's in Paradise Valley, and she does it out of her home. And it's similar to why I've started this way, but with Balanced Body Wellness is Jill's platform and business. She, within 1 week, I did 4 sessions just because I really wanted to do it. As I was like, let's get this better.
Get it done.
And a week later, I was full force, felt 100% great, strength back, and just the confidence to continue moving normal throughout my day. So, like, how do people not know about this? It's crazy that this could fix me. It was reasonably priced. It's 50, 60, $70 a session, depending. And the fact that you could feel so much relief from that, and
Mm,
just in my mind immediately, we've got to get this out there. Who
right.
else can benefit? Why are we not reaching more people? This seems like such an odd niche, and it should be widely known.
Exactly. And then that's when it came along that Sean, my old
Yes.
PT, like I said, was trying to help me through my injury,
Yes.
introduced me because you guys had met through his company, correct?
Yeah, I was looking for a space that I could go to that kind of understood the benefit and how
Mhm.
it could be helpful for somebody doing PT. It kind of loosens you up. You feel better. You feel stronger, that you have like a different confidence in your body. If you've had an injury somewhere, you kind
Yeah.
of feel like it's more stable. So you can push yourself that extra bit,
Yeah.
if you will. And so I was working with one of his clients one time, and then we met, and it was just like, oh great, this would be a great combination.
Well, and that's just it. Like Jackie, the reason that I end up doing this, you know me, like just just label me guinea pig, I'm like, okay, let's do it. Let's try it. Why not? I have to say, I went in listening to that machine. I was like, please do not start phantom planes. Please don't make this rear them up. I really was anxious about it.
And me too.
Yeah, I know.
Yeah.
I'm glad you didn't tell me that day. I'm not sure I would have done it because it sounds like a zapping machine.
Yeah.
And you can increase it and everything. But Jackie, this is where I was like, gosh, I know you work with tons of amputees. Amanda, I'm your first amputee you've worked with, right? And
Yes.
Sean was like, I wonder what would happen. And what was great is in 3 sessions that I had, I came in with like 3 very different sessions. My first one was never had done it, don't know what to expect. I was doing fine, but let's go for it. And I was able to crank it up at a certain level. We'll talk about that a little bit more, what that means.
Yeah.
And what I noticed, and here's where it starts to get good. Like, I wasn't dealing with phantom pain, but we wanted to see how it made an amputee feel afterwards. Like, you know, I mean, we all go through life. Like right now, my foot's buzzing. There's always something phantom-like going on. So I'm like, well, I wonder what would happen. What ended up being the end result is I didn't notice anything that first day. The second day, by the third day, my skin fit socket was too loose. So it took away inflammation I didn't even realize I was living with, is basically what that was, right, Amanda?
Yeah, good and bad. You're like,
I know.
great, I'm falling out of here.
Not so good. Yeah, if you get amputees, Jackie, that don't fit in their socket, have them go PEMF before they have to go back to insurance for a brand new socket for $2,000. Save some money that way. Second session was like, it was literally God's plan in my mind, because we really wanted to be like, if I ever get phantom pain, I'm going to call you up. She goes, call me. We'll get in right away. Well, the night before, I started getting that knife stabbing pain in my foot, Jackie, the bottom of my foot. And I was like, okay, I'm seeing Amanda. You know, I hate this feeling, but I kind of hope it's still going tomorrow. Like, that's like the weirdest comment I've ever made to myself.
Yeah.
Surely enough, going out to her place, my leg was doing the knee jerk while I was driving because it was just stabbing. On the way home, nothing. It never came back. So in my mind, a 1-for-1, that's pretty impressive, right? It could have been just wonderfully timed. It could have been, it's time to end anyways. But the irony that it happened the way it did was pretty amazing. And then Jackie beat me up today with her students because I worked on my hips a lot and my glutes. So I'm like, all right, Amanda, I hope this worked yesterday, because I used a pad along my back. And I was telling Jackie about it today. I was getting like throbbing pain up in my residual limb hip, but not my other side, which I would have thought, taking the brunt of force, that would have been the inflamed side, but it was actually my prosthetic side. And now we're going to wait and see how, this is only the second day. It hasn't been 24 hours. Tomorrow? Yeah, exactly. So Jackie, I'm really kind of hoping that this will be something that you two will be able to connect, because you probably have patients that are dealing with chronic pain or constant episodes that keep reoccurring. And I'd be very, very interested for people that have neuromas, because for us, when we have a symptomatic neuroma, you either deal with it, which is not a good thing, or you go in for surgery. I wonder what it would do to a neuroma, because that is an inflammation, a scarring of the nerve that's inflamed and really pissed off. So that would be an amazing thing to see happen. But Amanda, tell us basically what this PEMF is, what a session looks like. I've posted a picture of myself in the clamp. I wish I'd took more pictures, like the paddle and everything, but and then what those numbers mean and turning that up when I talked about that.
So there's 2 different parts of PEMF. You have the intensity and then the frequency. And so there's a lot of people like, oh, it's the same as that mat that I have at home. It's the same technology in the mat that somebody might purchase online. But the depth that can go into your body is minimal. So it's good for, if you want a good night's sleep, it's not going to help necessarily with injuries repair. And so with the intensity, the machine that I have initially was for horses, which Angie and I've also laughed about the horse connection there.
Yes.
And so the max depth for that machine is 18 to 19 inches. So when you're turning it up at full capacity, it's going pretty much through you. Somebody puts the paddle on their back, their stomach is shaking. You can see the effects of it. And there's multiple attachments just for different areas of the body. There's a bigger mat that you can kind of put on your back. There's a smaller paddle that's the most concentrated. It's just wound. All the coil is completely in this one small concentrated zone. So that would be for a knee, an elbow, somewhere, even the bottom of the foot. Some people with foot pain. I have a couple athletes that I've worked with where they've either hurt an ankle or the bottom of their foot, plantar fasciitis. There's all kinds of uses for it that every time somebody calls, I'm like, let's try it. Let's see.
Yeah. Right.
But at this point, there hasn't been anybody that said, hey, you know what, I didn't feel anything. It didn't really help. Every single time somebody's blown away by it, which is how I keep going. And as much as I like the fact that 3 sessions later, most people are gone, I also don't get to see them very often because they feel good to go. So as far as the frequency goes, the goal usually for me is to get to the mid-range that puts the electromagnetic field at the same frequency that it is naturally occurring on Earth, which that's where I think it sounds out there to some people.
It does.
But you're getting to what the frequency that your body recognizes and responds to the best. So with my machine, that's at about a 7 or an 8. It goes to a 12. But the goal is always to inch up to that spot. With Angie yesterday on her lower back, she was at an 8. And then for her leg, you were at a 13 because I have a bonus machine right now that I'll sadly have to send back. But
that thing's a beast.
But that one actually is for horses. So he's going back, but it was fun.
I'm not sure if I should be insulted or complimented.
Complimented.
Okay.
So exactly, can you explain the science of how it works? Because I feel like I still am a little confused and fuzzy on like how it is working and like the goals of the machine.
Yeah, and it's even for myself fully, like I don't have a science background, so wrapping my head around the science of it, and I can look into it over and over and just really try to reread. I'm like, I don't know that, but the body recognizes electromagnetic field, and it shifts brain signals. So it is changing your brain signal. So when we're talking about nerves, it is shifting how your brain receives that signal. Also, when electromagnetic field is pulsed into the body, not constant like an MRI machine, but pulsed in at a specific frequency, it shifts the way that your cell membranes are reacting. So it actually, if you look at blood work before and after a session, you can see the white blood cells separate, formed in not clumping, and it increases your blood flow, but also your cellular health. So the why I think is so hard to figure out why your body receives it that way and works, but all the studies that have been done, one of the best was NASA, just because they put in enough money to actually see what it does. Nobody else wants to dump money into something that isn't going to make a ton. So they now have it in spacesuits to prevent muscle atrophy and bone density loss in space. So they helped get it FDA approved for osteoporosis, osteopenia, and then it's also FDA approved for depression, but that would be a different machine than mine.
Okay. Yeah, so you had said that, and I'm guessing like with inflammation is our blood cells. Can you explain, maybe you know, maybe you don't know, but inflammation is really what's happening with our blood cells with that.
Yeah. And ones that are no longer functioning, but still there, not active, but still existing.
Got it.
So this helps to prevent the ones from becoming inactive. And then also it kind of gives you that immunity boost and can help you get rid of any senescent cells that are still hanging out in your body, causing
Doing their thing.
unnecessary, as far as inflammation. And we talked about lymphatic system and
Yes.
that part as well, that aspect of it, and where it can help there. It just activates kind of every part of your body, every part that it reaches, which with a strong enough machine, like I said, 19 inches, you're reaching it
all. Yeah.
Yeah.
Well, and Jackie, I think I may have talked to you when we were talking about one of your clients and a friend of mine that has lymphedema. And I was like, oh my gosh, all of a sudden yesterday on the way to her place, I was like, I wonder if this wouldn't work for her. You know, because they're talking now about people doing the vibration plates to get the
the lymphatic drainage.
Right, exactly. So I'm like, well, this takes it at a full another level. Like this takes it deeper and richer. And I was like, I wonder. So I told her about it. I'm like, you need to come on. You need to listen to this and see if this is for you. But, you know, I know we talked about that yesterday. It's like, I wonder if this wouldn't assist in that. And then the only question that we have is amputees still. And, you know, I mean, we're just trying this out, Jackie. Like we've done 3 sessions. She's only been with me 3 times and no other amputees. But the question would be, she used it if you have an injury, right? And you probably only need like 4 sessions. And then you're like, bye, I'm done.
Yeah.
As an amputee,
Right.
what is the long-term effect? Because obviously people can't dish out 50, 60, 70 bucks a week for the rest of their life. Most people can't. They want to be fixed or healed. So it's a matter of, is this a thing that can be used in the throes of a really bad episode, phantom pain episode, or, you know, like trying to wrap my brain around, I think it would be so helpful, but how long does that effect last us?
Right.
You know, any insight to that either one of you might have? Like, what do you think based on our theories? I mean, because really this is theoretical speaking now, right?
Yeah. Jackie, do you have any? I'm assuming not on the PEMF front.
Yeah, I wouldn't have as much as in the PEMF, but I think anytime there is something that helps modulate your pain, I think it's always worth trying, especially I think it's more so when you're having those episodes like phantom pain, it truly is different for everyone. Different things work for everyone. Like we talked about the different interventions. So if this is something that can help, you know, get you through your day when it's really bad, I don't see why it would be bad. It's like another tool in your toolbox. So if you've tried XYZ, nothing's worked, then this is nice to have another option. And worst case scenario, you have improved blood flow, you have less inflammation. Overall, like it's not like it's hurting you or making it worse. It's just, you know, helping your body in other ways that maybe eventually will help calm things down.
Well, and also we talked about bone density, correct?
Yeah.
Because when the blood cells are healthy, they can repair bone or thicken bone, right?
Yes.
Is that how our body works?
I mean, it's so hard every time. There's so many things you should see when I dive into something or print out studies on cancer and how PEMF has affected this. I'll have papers around, and it's hard for me to keep track of not having any sort of medical background and just being in it only out of interest and excitement in the field. But there have been studies that it increases your bone density. It would take a lot of sessions for that to happen if you wanted that, if you were trying to build back. So I wouldn't want to say, oh yeah, this has come to me 3 times and you're going to have bones,
and then you're all better.
When you were young. So I wouldn't want to promise that. But as far as it helping and assisting in your body being healthy overall, it absolutely does.
Yeah. Well, and it just, you know, it's interesting. This is going to go off on a weird tangent, so I apologize. But I've been digging and doing some research on OI because I know somebody that wanted to do it, but they were turned away because of bone density. So then I was like, oh my gosh, you got to try this. But I did some research this past week on OI and how people with low bone density, OI is supposed to be beneficial because it helps grow the bone, is what they're saying. And I was like, wait a second. Wait, now I'm really confused. So, I mean, that really doesn't have a lot to do with you, Amanda, but like Jackie, like that confuses me with amputees.
And I wonder if it's because, like, I would think that that would be someone that wouldn't do it. I would think you'd have to have a strong femur bone, right? Because they're inserting the rod directly through your femur. Unless the thing is like, when they re-break your bone to get it to heal correctly.
Right.
Unless it's that, like, just to
Right.
get that cascade going again. And
Yeah.
then because they're able to weight bear through it over time, everything starts, the stresses of that bone start to get stronger as you're able to load it slowly, is what my thinking would be, versus like if they weren't walking with the socket as much and not putting that pressure, and now directly
Right.
all of that force is going directly through the bone if they're able to load it
Yeah.
at a pace they're supposed to.
And I actually got that information from the doctor in Australia that created that OI. So, like, I'm not talking about something I read on Google.
Totally.
This wasn't Wikipedia. This was literally from his mouth, the person who created it out in Australia. And so that was really interesting for me today. Now, question about that, Amanda, with your system, because I let her know I have a DRG in my back, right? And it's not on. Something like, if they have osteointegration, can someone with a metal rod up in their body, and can they use this? Is that a bad thing? Is there, do you know?
It's not a bad thing. The only, sometimes certain metals, which I would assume, I don't know exactly what's used, but if there's a warming sensation, even people, like, even sometimes I'll have it on my own back and there's a warming sensation, but that's been the only thing noted for somebody with a metal implant of any kind. But you can have metal in the body. It's just anything battery operated. The magnetic field does affect it. Somebody with a pacemaker, cochlear implant, you can't use PEMF, or at least with my business.
Well, right. Well, and just to clarify, because when I have mentioned this to people, they have said, "Oh, well, I have this at home." Re-explain the difference between going to a practitioner who's certified and buying something off of Amazon and having a mat or a pad at home.
Yes.
Like, what is that difference, so that people don't look for a miracle from a $40 item on Amazon?
Yeah, because the Gauss is the intensity. That's how it's measured in Gauss. And so this machine that I have goes to 6,000, and that's how you get the depth and actual benefit. Also, to be able to mess with the frequency, because there are different frequencies that our body, the lower the frequency, the better it is for nerves. And so you want to get to the lowest possible frequency when you're working with that as the main goal. Soft tissue and muscles is a different frequency. The ones you're buying, and sometimes they're not even that cheap for what you're getting, but they are, maybe, I don't want to say the wrong number. I guess I'm not calling out their names anyways, but 100 to 500 Gauss max, I would think would be. I think they're much less than that, though. I know that the depth, when I looked into it, a friend was like, "This works well. I'd love to just be able to do it every day." I found something, once I looked into it, it was one of the popular mats. It was like $2,000, and the depth would be about a half inch. So you're getting a half inch depth out of a $2,000 mat that's being sold to you. Is that great for wellness? Sure. But just very, very surface level. So go to somebody. There's different brands that I have. The MagnaWave. They also produced Pulse a while back, and then Hugo are all three that I personally would trust as far as different PEMF manufacturers. They all will have different lines of things, but the Gauss is what people need to check in with.
And yours was what again?
Know what
and what was your level? Your level goes to what again?
6,000.
6,000. So if someone is listening to this and they don't live here in Arizona, where they can just reach out to you and come see you, please, if you're in Arizona and you're struggling, amputees, give her some more data, be a part of that and see if it helps you. What do people research to look up and find a good practitioner that's doing it at the right level to help the way you've helped me?
Yeah, so MagnaWave has a site. There's a practitioner map on there. You can go to magnawave.com. Some people put their business on there. Some people don't. I personally don't have mine on there, which sounds crazy, but just I didn't want we're in Arizona, it could be horses. And I was like, I don't want to have, we're just doing people so far. But there's plenty of people that are on that map. I've reached out to somebody in Minnesota and found someone, and California and found someone. So you just have to look it up and make sure, ask them, like, how strong is the machine? What's the goss? It matters.
Will
So
you
they
see
should
it?
know.
Will they be able to find it in, I mean, do they usually have their own like centers, or are they in physical therapy offices? Like, is it an add-on to physical therapy?
Sadly,
offices?
not a lot of physical therapists have combined with PEMF practitioners yet. I think it's just a lack of, we don't know about each other a ton, but I gladly would partner up with different offices to go in and do, even if it's just a one day where you're like, hey, let's set a few people up on it for this day a week or whatever that looks like. And I think there's a lot of people out there that work either mobile. Most people are mobile. Then there's some machines that are sold to kind of be a one size fits all. And some gyms even have them that you can go, and they're actually really great. There's a gym in Phoenix called The Hive.
Yes.
And they have a PEMF machine that is a great machine. So if you're part of The Hive, you can go there.
It's an expensive membership.
I'm sure, because you could go in and use PEMF and run like therapy.
It is an expensive membership, but I've heard it's very bougie.
Yeah, I have not been, but I at least know it's a trusted spot for the good stuff. But yeah, I would just look up people in your area, look up PEMF practitioners, and then see. And if it's some tiny little machine, it's just not the same. That was one thing, Jackie, I didn't touch on earlier, and you had asked about how it works. And I was just going to mention the machine. There's digital and then there's analog. I have one of each. I favor my analog machine. You feel it differently for whatever reason. The signal that's delivered is more physically felt. And I just think all of us kind of, if you feel it, you're like, oh, it's working.
It's doing something.
So the digital, though, still gets great results. And I don't know why I haven't just loved it just as much, but it builds up. There's a spark gap chamber inside this big box, and it builds up electromagnetic field, pulls it in, and then delivers the pulse. And so as it gets stronger, it like widens, so it takes longer for it to build up, which gives more energy delivered. So that's how, like, the actual machine, you can't travel with it because it looks wild when it goes through a scanner at the airport.
I bet it is. It's frightening at first, but it was interesting. I'm a visual learner, so when you explained that to me, I could totally visualize what was going on. And to increase that level, thinking about, like, let's just say those fingers separating more, it takes a lot more of that energy to connect that wave.
Yes.
And that's why it ramps it up. When they're really close, it doesn't take as much energy.
Yeah, and it's quicker. And
Well, and I'm sure we've tried it. I think we've had someone demo something similar in the clinic before, because sometimes we'll have people from different companies. Like, I don't know if you've heard of Shockwave. They send so that we've had them like come for a day, and then we'll send patients in to try it and stuff like that. But I think it's been a while since we've had someone with PEMF.
Okay.
We need to get you in there, Amanda.
I know. Yeah, because we have tons of chronic pain and all of that. So it's always nice to just try something else and see if it works.
Definitely.
Yeah. So when I did it, and we'll start wrapping it up here, but when I did it, just so people kind of understand, it's really hard to explain, but it's almost like a soft clamp that went around my entire residual limb. And it runs through that. And as we ramped it up, I didn't feel anything. And you get to slowly do it. Amanda's great. She's like, okay, do you feel anything? No. Okay, 3, 2, 1, we're going up.
Yeah.
And then don't feel anything. Okay, 3, 2, 1. And we kind of got ourselves to a place where I'm like, oh, I'm starting to feel it, but I can tolerate. So you control that. They're not just like, it's not an on or off. It's a level.
Yes.
And then the fun part is when you get to that level that it's really working, it feels like the hairs on your body just stand up, because there's like electrical fields going through your body.
Yeah.
So you feel like you're very electrically charged. Amanda's like, maybe put your phone down and don't touch my dog.
Yeah,
She
you
shocked
can
her dog
shock them.
once.
You're like, oh, I'm sorry.
So, you just kind of want to just sit there and relax. But it's really relaxing, 30-minute session. That's all you do it for. The paddle that you talked about that you had as an amputee, it was great. I lifted my leg up. We put it right underneath my leg. Yes, my prosthetic was off. You said we probably could do it through it, but I really wanted to feel the real thing on my body.
Yes.
So I didn't want to be going through material. I wanted it just going through me, So eliminate whatever you can. But that was amazing. And like I said, the pad for my back was huge. And it was interesting because you explained it to me as it was going up, and I couldn't tolerate, like you said, it's harder to tolerate the back as much as the leg. But I was telling Jackie how it was just literally throbbing deep in my hip. And I'm like, what is that telling me? And you basically, was it that it's inflamed there, or it's frustrated? That part of my body's tense, or how did you, why was it that?
Out it. Don't know how again, but it kind of finds, like, you'll say there's a pain in here somewhere. You put the machine on it and it's like, oh yeah, no, it's tapping the exact spot. So it kind of does seek out inflammation in the body or tension points, and you're almost getting like a reverberation of the electromagnetic field reaching something, and you're kind of feeling that bounce back of it. And so that's sometimes you'll get movement on the body if it's in a shoulder or even the back, and you'll have movement in other areas where it's kind of tapping on. And if you watch videos of horses, because they're so muscular, you put it on them. If it finds a spot, it's
you'll see them. Well, and I think it's just neat because I will tell amputees listening, I have not had any phantom pains get triggered by it. I did have an episode where they were taken away from me, and I have noticed an inflammation decrease in my prosthetic leg. So even in just 3 sessions, and I'm still waiting to see how yesterday's is playing out in my body. Although I'm not sure with Jackie with that workout today, I might just be sore. I mean, I may have to come back in again. They beat me up today pretty good on my hips, but I think there's some real positive momentum. And I think what we need to get more people to see how it affects different people. But I didn't feel any negative effects. None.
Which was was a concern of mine too. I was so excited about the opportunity, but also,
a little nervous.
Part of me that was
Tell me about it. I went home going, I think we're good. But it was amazing. So, I mean, Jackie'd be great if it touched on we could get her to come in and just have some patients that are lined up that I know you have that probably could benefit from a session just to see what it looks like, feels like, and educate, right? To educate. Yeah. So, Amanda, if there are people listening that are from Arizona and they're like, oh, I really want to connect, how can they connect with you to maybe get on your schedule?
Yeah, you can reach out on Instagram. I also have it's Optimal State AZ, and there's a link on there that takes you straight to my booking page. So you can book through there. I try really hard to keep a very updated schedule. Occasionally I'll have to ship something if a kid needs, sports schedule changes or something. But for the most part, I keep it really up to date, and I currently work out of my home. So you can reach out and find me there. But like I said, Jackie, if you ever wanted to try something out together, I can do that too. So I'm happy to be mobile within certain areas. It's just sometimes the travel time makes it harder to see enough people in a day.
You're actually not very far from them. They're like the Arcadia area.
Okay.
They're like Indian School and 44th is how I get to the Limb Center, and they're just south of that.
Oh,
so you're really not far from Touchstone Rehabilitation.
Okay, that's great.
So well, this was great. Jackie, any other thoughts or closing thoughts on this as a possibility as a physical therapist?
I think whatever, it's always nice. Like, you always hear bad things about modalities, like, oh, modalities, they're not treating the root cause, but sometimes we don't know what's causing phantom pain and other pains, right? Like, so if there's things that are helping, I am a proponent to just doing things that help you be able to stay mobile, limit the amount of medications that you have to take. So whatever that is, I am all for it.
Yeah, you try it and you figure it out. I mean, we're everybody is really still, I mean, in the scheme of amputations have been around forever and ever and ever, right? But the fact is as after talking to so many people in the medical field, no one has done data and research on phantom pain because doctors ignored it and said it was all in your head. And they didn't treat it, so they weren't studying it. They weren't getting data for it. And so we're still in the young stages of learning really what is triggering them. And everyone is different. And as Jackie knows, what works for you one day is not going to work the next day. It's just the weirdest thing. But if this can bring that inflammation, which may also then help with maybe, and I think, Amanda, I told you this, and Jackie, we've talked about this. If I do take any medication, it's when I'm at my wit's end. I can't stop crying because the pain has been 3 or 4 days, and I'll grab Tylenol or an anti-inflammatory. Take a couple, and then that placebo effect. But I'm like, well, maybe it's inflammation because if a nerve gets upset and frustrated because it's been beat up, I have flare-ups. When I work out, I get flare-ups. So maybe it is the inflammation. Wouldn't that be a great thing if we could take away inflammation with this? No medication destroying your liver and your kidneys and all that other stuff, and all naturally dealing with the Earth's, frequencies.
Yeah, it's giving it to us. We might as well.
I know, right? Use it. Use it. If it doesn't work, it doesn't work. But if it does, wow, what a game changer that would be. So excellent. Well, I want to make sure you two get connected. And if you guys want anything, I'm going to put in the summary. I'll put in Amanda's company name so you can reach out and check out her schedule. I suggest you give it a try. Just try a session. Get to know Amanda and hear a little bit more about it. I think it's definitely worth an amputee trying it. When we're always looking for the next best thing to help us get through something. So,
and if there's last thing, if anybody is looking for someone in another area, I'm happy to help with that too. I can seek it out. I've done it for plenty of people that are out of state. So I can always find somebody that I'd say, hey, check these 2 places. They seem the best. So
awesome. Well, Amanda, thanks for coming on. Our first special guest, Jackie.
Yes.
Thank you, Jackie, too. It was very nice meeting you.
It has been a great conversation, Jackie. As always, love getting on. I'm so glad we had our time this morning as well. And let's get this PEMF off and running with some amputees, and let's get some more data.
Yes.
I think it's worth it. All right, you guys take care. Have a great rest of your week.
Bye.
And we'll talk next month. All right. See y'all.